Hi everyone, good afternoon. Hope everyone have their lunch already. So I'm Derek, an acupuncturist at Tan Tock Seng Hospital Acupuncture Clinic. Okay, so today we have a 1 hour for my talk. Today I'll be going through mainly on neck pain and DIY acupressure exercise. So today you'll learn some tips and some exercises for you to do at home to help to relieve neck pain. Okay, so why neck pain? So neck pain actually for my day-to-day clinic, usually for neck pain, patients with neck pain. So most of the time, it makes up of 1/3 of my patient load for neck pain. So recently, especially after COVID, and not say so. Okay, so during COVID, when there's a circuit breaker, everyone stay at home, starting to work from home. So after maybe probably that was 2020. So during 2021, 2022, so this year, we start to have more and more people with neck pain. Yeah, because they start to work from home, then they don't have the proper equipment, don't have the proper working chair, don't have the proper ergonomics chair, tables. Some sit on the floor to do their work, and sometimes they can do up to for the whole day, 5, 6 hours without moving. So that's where all the neck issues starts to appear. Okay, so that's why I'm going through neck pain for today. So my overview for the talk today. Firstly, we'll start on briefly go through some of the structures of the neck. Then I'll touch on the causes of neck pain. Then after that, the TCM perspective on neck pain and also other pain condition. And also lastly, the main gist of the talk is the DIY acupressure exercise for the neck. So not only you'll be learning acupressure, you're also learning some simple stretches and simple exercises to do, okay, to relieve your neck pain. All right, so let's start. So let's talk about the structure of the neck. So we're going through three points: bones, your bone, your muscle, and your nerve. So right now we start with the bone. So for the neck, there's 7 cervical vertebrae in your neck. So the neck vertebra is located in this, cannot see here. Okay, there's 7 bones, 7 vertebrae. You can mainly C1 to C7. So sometimes when you see a doctor, the doctor tell you, oh, your C5, C6 got problem. There's some pressing on the nerve on C5, C6. What he's referring to is the position of the cervical spine. Okay, it's the vertebra itself. So you can see it, if you look at the top right hand corner, you can see I circle one transverse foramen. That's where all the artery, veins, nerve passes through. So sometimes when that gets pinched or due to maybe slip disc or some muscle pinch, then you start to feel the other symptoms, pain or everything. So you can see the other one is the vertebral foramen, which is highlighted in green. Yeah, that's where the spinal cord passes through. Okay, so for the vertical cervical spine, usually there's a gentle curve, a gentle C curve. Okay, that's the normal C curve. It's not because your neck is crooked. This is a normal C curve. So if it's straight, then that's where all the problems arise. So okay, so that's for the bone. So I'll be going through quickly for all this structure just to let you all know. Okay, next one. Okay, next one I touch on the muscles. So muscles, there's a lot of muscle groups around the neck. But I'll just briefly go through the few main ones. So you can see I'm introducing to you the trapeze. So trapeze is one of the very big muscle group behind the neck. Okay, what it does, it helps you to, so it's over here. Okay, it helps you to extend your neck upwards and downwards like this. Okay, and also side to side flexion, we call it lateral flexion. And one important thing is it helps to counterbalance the pull of the gravity of your head. So your head now weighs around 5 kilograms. So every time, so for example, if you keep looking down, keep looking at handphone, it puts a lot of stress on the trapeze muscle. That's why sometimes you can see some people, they have a very big lump over at the back of the neck, right? That's when the person keep looking down, then the trapeze muscle needs to be bigger, need to be stronger so they can support your neck. That's why when years pass by, then the trapeze will get bigger, so it gets more muscular to support your head. That in Chinese we call it 富贵包 lah, which is over That's right behind on the neck here. Okay, so trapeze, that's one. Next one is I'll introduce scalene muscles and also the SCM, which is sternocleidomastoid muscles, which is at the side of your neck. So sometimes you brush your teeth, you clench, you bite your jaws together, you can see there's two tight muscles at the side of your neck. That's SCM. Okay, what it does, it helps to flex and rotate the neck like this, and also aids in breathing because it's connected to your clavicle, the bone here, which helps to lift up your rib cage. Okay, so these are the why I talk about these few muscles, because these few muscles is one of the more common muscles that will get injured during when you have neck pain. Okay, so sometimes if you can see at the trapeze, it starts from the neck all the way to the shoulders and all the way to the upper back. So that's why sometimes if you feel neck pain, doesn't necessarily you only feel the pain on the neck. Sometimes you can feel the pain radiating down to the shoulders at the same time. Okay, so next I'll talk about the nerve. So there's a lot of nerves passing through the cervical spine. Okay, you can see at the picture on the right side. So all these yellow lines are the nerve. So you can see some nerves goes up to the brain. Some nerves go up to the skull. Some nerves go towards your face. Some nerves go down to the arms. Okay, that is why sometimes when there's pinched nerve, you can have headaches, can have dizziness, you can have eye pain, can other symptoms like hand numbness. All this is because all the nerves passes through the cervical spine. It comes out from the spinal cord and goes all the way to your other different body parts. Okay, so that's for the nerve, for the bones, the muscle and nerve. Okay, so now let's touch on the symptoms of neck pain. Okay, so neck pain, everybody will feel pain, the neck pain. So pain. Okay, so pain is one of the main symptoms that you will feel. Other than that, neck and shoulder stiffness. Neck and shoulder stiffness when the muscles are too tight. And other than that, if it's affecting the nerve, then you have tingling, you might have numbness, you might have weakness on the upper limbs and fingers. So depending on so I go back one slide. So depending on which nerve is pinched, you can have numbness at different fingers. Okay, so sometimes you can have the last three fingers and the first two fingers. So depending on which nerve is pinched. So other symptoms can include headache, dizziness, nausea, tinnitus, so on and so forth. Okay, so basically the upper body, usually the symptoms is at the upper body, unless it's pinched onto the spinal cord. That's more serious, then that will affect the whole body all the way down to your lower limbs, basically to your legs. Sometimes you cannot walk, you feel loss of balance, all this. That's when it's more serious, it's pinched onto the spinal cord, where your main central nervous system is. Okay. So next is causes of neck pain. So there's a lot of causes in neck pain. So number one is the external injury. So external injury can be whiplash. Whiplash is usually happens in a traffic accident. So some car bang onto you, then you have the sudden inertial force that will cause your neck to go forward and backwards very quickly. That's what will cause some injury to the neck. And of course, you fall down, you hit your head, or sometimes something hit onto your neck. And so suddenly heavy lifting, suddenly you need to lift up something with your head, then it'll cause all these external injury. So external injury, this one is more acute. So the source is very clear that you have an injury, then it's very acute and the pain comes immediately. So next one, incorrect posture. So incorrect posture is how you sit, how you do your daily activities when you are working, when you're sleeping, or when you're sitting or doing your work. Okay, so incorrect posture, this one is one of the main thing I'll talk about later, because all this posture, right, is one thing that you can change on your own. Okay, so next one, wear and tear of joints, or commonly known as osteoarthritis or OA. This is when there's damage to the bone, to the joints at your cervical spine. Some could be due to overexertion from your work, injuries, or also inactivity also can cause all this, cause osteoarthritis. And you have the physical emotional stress. And the next one is the gastro reflux disease. So this is acid reflux. Okay, so acid reflux, why acid reflux can cause neck pain? Because when you have reflux, your whole body will tense up like this. So if the person has acid reflux almost every day, every hour, that's when the neck muscle get more stiffer and stiffer throughout the day. Then you proceed on to the neck pain. Okay. So you can see that all this from external injury all the way to acid reflux, one of the things that actually you can change actively is actually incorrect posture. Right, because this is the thing that you do every single day when you are working, when you are at home, or when you are playing outside. Okay, that's one thing. So today I'll be touching on I'll put a bit more focus on the posture, and later I'll talk about wear and tear of joints. So wear and tear of joints, this one, the joints there's already a bit of changes. So this one you cannot revert back to the original state of the joint. So that's where correcting of posture can help to prevent wear and tear of joints. Okay, so you can see the picture below, weight of the head when looking down on the phone. The lower you look at, the heavier your head becomes. You can see if you are looking straight 0 degrees, your head is just 5 kg. But if you look down more and more, your handphone, when it reaches 60 degrees, your head is actually 27 kg. Okay, that's when you put a lot of pressure on the neck behind. And that's all the pain that comes. All right. So posture. So I'll be touching a bit on posture because I believe I think most of them are working adults. Okay, working adults, you use your handphone. I think everybody will use their handphone. Nowadays, when you go to the MRT, you go anywhere, you see everybody is on the handphone. Right, even my patients all waiting at the clinic also all watching some sort of shows or they're on their Facebook before they come into the treatment room. Okay, so posture. So you can see on this picture now, you can see the normal curvature of the spine is actually slightly curved. So you can see the lady in green. That's the normal curvature of the spine. So you can see there's a slight curve, slight S shape. This is normal curve. So once it reaches straight, like the one in the middle flat back, that's where all the problems will come. Too curved also cannot. Too curved, then it will result also in a lot of problems. So you can see increased lordosis, increased kyphosis, flat back. Too curvy, no curve, also will cause a lot of pain. Okay. Okay, so types of posture. Okay, you can see there's 3 types. 3 main types. Okay, first one working. Second one using smartphone and tablet, and the other one is basically sitting on the chair. So I briefly go through some. So first one, working. So working, I think I have another clearer. Let me go to the next one. Yes, this one. So when you're working, you correct posture for work. So when you're working, I think most of you are on computer most of the time lah. Some can be So I have patients who work on the computer can at least 7 to 8 hours. Sometimes if OT, I can reach up to 12 hours in front of the computer. And sometimes they can say that they didn't stand up during that 5 to 6 hours. Okay, when they are very engrossed, especially when there's meetings going on and so forth. Okay, so you can see on the left side, back posture. So you start with the back one. So the head is slightly down because the monitor is down, the shoulder too high, or desktop not in front of you. Sitting posture doesn't support the lower back. Okay, so for good posture, how to maintain a good posture when you're working? So importantly, 2 things. Take note of your neck and take note of your back. Okay, so for the neck, you don't want to look down. So what must you do? You must keep eye level with your desktop screen. Okay, or your laptop. So sometimes laptop too low, like right now the laptop I'm using a bit low, I need to look down, right? So if you are doing this on a daily basis, you need to prop up your laptop by putting a laptop stand. Okay, make it higher so that you have you can reach a high level, then And of course, once you have if you have laptop, you put on a laptop stand, what happens to your keyboard? Your keyboard will be very high, right? This also no good because after you do work like this for a few months, you start to have pain at your hand, pain at your wrist, sometimes at your neck, because sometimes you prop up to do your typing. Okay, so if you're using laptop, prop up laptop stand, you might also need an external keyboard and external mouse. Okay, so desktop you need to put in front of you, don't put at the side. Sometimes some people have multiple screens all over, right? All over, some have three, four screens. Then you'll keep looking left, looking right, looking left. So try to maintain straight so that you can look straight at all times if you are working on one computer screen. So for the back, your butt push all the way back to the your back of the chair. So you need to support your buttocks. Kiss, so sort of buttock kissing onto the back of your chair. Then just lean on the backrest. Okay, then legs maintain 90 degrees. That is the proper posture for when you're working on a computer or when you're working. Okay, I know sometimes when there's too engrossed and patient will say, I'm too engrossed in meeting will take 2 hours, then I'll be listening, then I'll lose all this good posture. So one thing is you can remind yourself. So sometimes when there's people with smart watches, you can set timer. So you can set 1 hour timer to remind you to keep back into this good posture for work. Okay, so I go back slides. So for smartphones, tablet, later I'll show you another picture for a proper smartphone tablet. And for sitting, just now I mentioned, your butt need to touch all the way back to the backrest of the chair. Okay, so support, then lean onto the chair. Okay, so you can see the first two pictures, the back is not supported by the backrest. That's why you put a lot of pressure onto your back. And after that, you also have neck pain, you also have back pain. Okay, another one is sleeping, correct posture for sleeping. So bulk of my patients also say, usually morning they wake up, my neck very stiff, my neck very pain, my hand numb. All this could be due to the posture when they are sleeping. So sleeping, the pillow too low, pillow too high, might cause all these issues. So what you need to do is, when you have your pillow, you need to test it out. So you lie on your back and you lie on your side. If your head tends to curve one side like that, this means the pillow is too low. If not your head, if you curve too high, then the pillow is too high. Okay, what you need to see is from the head all the way down to your torso, you need to be a straight line. That's where the pillow is good. It's suitable for you. Okay, so pillow actually is very subjective to the person because each person, the spine is different. So sometimes when you wear and tear, the spine curvature is a bit different. So those patient might need a different kind of pillow. So you need to, so usually patient ask, what kind of pillow should I use? Then I will say, you need to try and error. You need to find a suitable pillow. So you need to test it out. So before you buy, you can test it out first. Is it too high, too low? And when you go home, you test it out for a few weeks, see whether this condition, your neck pain or neck stiffness will keep recurring. If not, it doesn't really recur, then the pillow is suitable for you. Okay. So yeah, the last one I'll be touching is the hand using smartphone. Okay, so what will happen if you have a poor posture when using a smartphone? So this now they have a term called tech neck, technology neck, I think. Yeah, where a lot of people are. So when you're using your phone, you tend to look down because you won't lift up your hand to look at your phone because sometimes your hand get too tired, right? So this is one of the most comfortable way of looking at your phone. So once you do that for long hours, your trapeze, that's why I mentioned the trapeze behind. Okay, where you will extend the trapeze. So once extend for too long, it gets tight, gets stiff. So if continue doing that, your SCM, so the sternocleidomastoid, okay, the muscles here will shorten because you don't need to lift up. Your body to say, hey, you don't need this muscles too much, so I help you shorten. So save your energy to do other things in your body. Okay, so this one becomes shortened. Then the other muscle, other spine will compensate. What do you mean by compensate? Because when your one muscle gets too tight, the other muscle will compensate their activities of the other muscles. So for example, the first one, so you can see SCM shorten, right? So next time if you want to lift up your head, you will utilize other muscles. So other muscles will follow through, also get to tighten. Okay, because they at the first place they don't have the capacity to support the head at the first place. So other muscle and spine will compensate, and that's where you get all the pain everywhere. Okay. So correct posture for using cell phone, basically you need to look straight. Okay, avoid looking down. Try to look straight. So in what I usually tell patients when they are on the phone, especially those elderlies, just use a support. So use the other hand to support the one that you're holding the phone. Okay, so you can cross your hands, just do like that. Then you can look at your phone. Okay, if too tired, if you like to watch movies on your handphone screen, another way is to use what's it called? What stick is that? Selfie stick. Yes, selfie stick. Thank you. Yes, you can use a selfie stick. Okay, if you use selfie stick, okay, people might look at you, laugh at you, but then again, you don't have any neck pain, so actually it's quite good lah. Okay, so take back. Try not to look down when you're using your phone. Okay, if you observe, so if you're taking MRT later, you just put down your phone and just take a look around you. You can see that you can see how other people's posture when they are using the phone. Then you can see what happened to their neck, what happened to their back. So one thing I like to do is just observe people on the MRT, and then you can see that, hey, how come the neck area so enlarged? And then you know probably this person like to keep looking down and probably has some neck pain. Okay, so that's for posture. So one thing. Okay, so posture. So just take note, everybody. So those who are working, those who like to use phone, those who like having neck pain already. So just take note of the posture. See where you can change it before something serious happen. So something serious is wear and tear, osteoarthritis. So that's when irreversible change will happen to your bone and to your soft tissue. Okay, or your joints at your spine. Okay, so example of wear and tear, you can see slip disc, narrow disc, bone spur. So bone spur is like a normal growth lah, a normal growth out of your usual bone. So sometimes your bone is a nice curve, right? And then the bone spur, something will jut up, like something will jut up, and that's called a bone spur. Then, all right. So all these changes cannot be reversed, but it can be managed. Okay, so sometimes the doctor will tell you, you have this and this and this and this. But okay, I put it this way. So some people may have all these conditions, so as slip disc, bone spur, but they don't feel any pain. However, some people with all these conditions, and they feel a lot of pain, in a lot of pain. Okay, so why some people may have all these conditions but no pain is because their muscles are kept in a relaxed state. So they exercise, they watch out on their posture, they lead a healthy lifestyle, all this, then they can reduce the pain, although the condition is still there. Okay, so by staying active, maintaining healthy weight, maintaining good posture, and also staying active as in exercises. Okay, all this can help to slow down the progression of the disease. All right. So for example, if slip disc, so you can see something hernia out of the disc, right? So then it won't cause any pain. But if you continue with your lifestyle, your improper posture, it can slowly come out even more. The disc can herniate even more. That's when you press onto the nerve, press onto the spine. That's all the problems will worsen. Okay, so that's osteoarthritis. Okay, now let's touch on TCM. So what's acupuncture if you are TCM trainer? So we need to talk about a bit on TCM. So for neck pain, any pain condition, we classify it as P syndrome. So in Chinese, we call it P zhen. So this can be caused by external causes such as wind, cold, and dampness. So wind, fong, cold is han, and dampness is shi. So sometimes if people their pain will get worse when it's raining, or when there's strong winds, when they stay in aircon for too long. That's where how we classify wind, cold, and dampness. So dampness, and when it's raining, it's damp and cold. That's where all the pain starts to arise. Okay, so all this external, also we call it environmental pathogenic influence can cause to affect and block the flow of the qi in the body. Okay, so you can see on the side, I have this pipe, right? So later I'll touch on what is this pipe. So imagine your qi is flowing into the pipe. So the qi can be signified as the water here in the pipe. So once it get blocked, so something blocking the pipe, that's where the pain will arise. Okay, so usually this is for acute condition. Acute condition is in the sense that the pain comes suddenly and it happens like 1 or 2 days after the injury. Okay. Next one is internal causes. So internal causes refer to internal disharmony or insufficient qi in the body. So you go back to the pipe again. So for example, if the pipe is leaking, you're leaking the qi out from the pipe or leaking the water out from the pipe. So your qi going lower and lower and lower. Because there's some leakage. So this can be caused by stress, poor diet, overwork, lack of exercise. So internal causes will slow down the flow of the qi and blood in your body, resulting in pain. So this usually is for chronic condition where the pain is like for many years or many months. Okay, so just now the pipes, right? You can see the pipes just now. Or this pipe. Also, what is the pipe actually? So the pipes I'm talking about just now was what we call meridians or jingluo in Chinese. So that's where all the qi and blood flows through. So in TCM perspective, we call it channels in which the qi and blood flow through, and it works as a network function that travels all over the body, from the head all the way to the legs. Okay, it's similar to the blood circulatory system in the Western medicine. So in our body, usually we classify main meridian channel and also collateral vessels. So this is just to let you all know. So we have many meridians in the body. So the main or primary meridians, we have 12. So if you can see the picture, the first 12, or rather, all of these are the main 12 meridians that we use. It's all those meridians that we commonly use during when we treat patients. So for acupuncture, usually use all these 12 meridians. And then we have all the extraordinary vessels, divergent meridians. Okay. So you can see that all the meridian passes through from the head all the way down to the legs. So it's connected throughout the body. Okay, so on the meridians, there are some points. So acupuncture, sometimes you choose a point to poke, right? That's the points are called acupoints. Okay, so there are these points are specific points where the qi of the organs and meridian network flows and connects. Okay, so we total around 361 acupoints on the body. So some studies also shows that by stimulating all these acupoints, it can help to reduce pain. Okay, so you can see on the picture, there's a lot of acupoints. So imagine when we are studying and we need to memorize so many acupoints on the body. Okay. So how we manage the pain? So for us in our clinic, mainly we do acupuncture and cupping. All right, so sometimes you go to another TCM clinic or private TCM clinic at your neighborhood. Sometimes they will give you also TCM medication and also guasha. And sometimes you go for tuina. Tuina is a form of massage, but it's more specific. So it's not like your 1 hour massage or 2 hour massage that you go with all the essential oil. It's different. So tuina massage is more painful in the sense that you will press onto the pain point, directly treat the pain condition. Okay, so for us, we mainly do acupuncture and cupping. So these are the few common treatment modalities that we will use when you visit a Chinese medicine physician. Okay, how does this treatment helps you? So number one, it helps to relieve muscle tension. This is the main one. So helps to relieve muscle tension. Once relieve muscle tension, it will improve the blood circulation and stimulate all the nervous system, trigger all the pain reliever hormones, and also to promote self-healing, and it will in all help to reduce the pain. Okay. Okay, so now we'll go into the main part of the section, do it yourself acupressure exercises. So what is acupressure? So acupressure is basically doing sort of your own acupuncture without needles. So you using your hands or some tools, then you press onto the specific acupuncture points on the body to help relieve tension, help relieve pain. Okay, so the aim is the same as acupuncture, mainly to clear the blockage or any abnormalities in the flow of the qi in the meridians. Okay, so sometimes the last point, acupoint can be pressed, may or may not be directly positioned in the affected region. What does this mean is sometimes you have neck pain, but I will teach you how to press it on the hand. Okay, so sometimes I press on the hand to help relieve the neck pain. Same as acupuncture, so sometimes when you go for acupuncture treatment, sometimes we will put, so say for example, you have back pain, you come in for back pain, but I put needles on your hand. Okay, so why is this so? Because the meridians will pass from the hand all the way down to the back. Okay, so sometimes you might don't be mistaken. Hey, I having back pain. How come you poke on my hand? Don't mistaken that the physician don't know anything. So these are the meridian theory that we have that will help in your condition. All right. So sometimes more commonly one that I use is sometimes we have left shoulder pain. I will poke on your right leg. So some people, hey, why is this so? Because same thing is the meridian theory. So from the left side we go all the way to the right side. Okay. So that's acupressure. So you can see on the neck there's a few meridians that's passing through, mainly 1, 2, 3, 4, 5, 6 of them. Okay, just briefly know there's 6 meridians passing through the neck. So later some acupoints that I will be introducing are some of the points on these few meridians. Okay, so let's start. So everybody online, you can do together with me. So I will demonstrate where's the point, then you can press together with me. Okay, you can find for the points and do it together with me. All right. So first one we will be introducing is Feng Chi Xue. So Feng Chi Xue is located on the back of your head, the base of your skull. Okay. So this one you can help to improve. So there's some study shows that by pressing Feng Chi, it can help to increase the blood circulation up to your head. Okay, increase blood circulation in the neck, in turn going up to the head. It also can help to lower blood pressure and also relax. Most importantly, relax the muscle at the neck. Okay, so this acupoint can be used for all types of neck pain. Other neck pain also can use when you are having headaches or a bit of dizziness. You can, like vertigo, you can use this point also. All right. Okay, so where is Feng Chi? So Feng Chi, like the back of the head, back of the skull. Okay, so it's over here. You can see here. Okay, so it's below your occipital bone, your skull. So you just run your hand down all the way to the end of the skull. Then you go all the way to the end of the skull. Both sides, you can feel a depression. So this depression is between the SCM and the trapezius muscle. Okay, so this depression, you hold your hand, you put it like this, use your thumb. Okay, push up into that depression. You will most likely feel a aching sensation. Okay, if you cannot find aching sensation, just move around your thumb, find another depression, and you can push it up. So what you need to feel is a aching sensation when you press. Okay, if you feel nothing, then you're not pressing onto the acupoint. All right, so once you find that location, push it up and rotate your push it up and rotate your thumb. Okay, can be clockwise, anti-clockwise, doesn't matter. Most importantly, you need to feel the sensation. So then you can rotate up to 50 times. So let's rotate 50 times and do 2 to 3 sets. Okay, so if you a bit headache, a bit dizziness, or neck very stiff, I can press onto the 风池穴, 风池. Okay, so that's 风池. You can see this picture is clearer. Okay, so same thing, place 2 times on the 风池穴, gently press, apply pressure. Most importantly, must feel the aching sensation and massage 1 minute. So 1 minute can take around 30 to 50 times of rotation. Okay, continue 2 to 3 sets. Okay, that's 风池穴. So next one, 曲池. 曲池穴. So it lies on the large intestine meridian. So this one, yeah, useful for treating acute neck pain. So what is acute neck pain? So it's the neck pain comes suddenly, come sudden and sharp. So things like sometimes you wake up, wow, my neck very stiff, my neck very pain, I cannot turn my neck. That's where you can use this acupoint, 曲池穴, to help to relieve some of the tension of the neck. Okay, so other than neck pain, you can help with shoulder pain, elbow pain, and sometimes an arm numbness. Okay, so how to find 曲池穴? Okay, let me put this down. So you just keep your elbow bent 90 degrees. Yes. Okay, so just keep bent 90 degrees. You can see the crease of your elbow. So the crease ends here, right? So between this crease and the bone here, there's a bone here. So the crease just follow through. There'll be a bone here. So between this bone and the end of the crease, 曲池穴 is located in the middle of this line. Okay, the line between the crease, end of the crease and the bone. Okay, so that's 曲池穴. So how to press? You can follow this slide. Okay, this picture. So you just put 90 degrees. You use the other hand with your thumb, locate 曲池穴, and just rotate. Apply pressure and rotate. So same thing. Most importantly is to have the aching sensation. So all acupoint, you need to have the aching sensation. Then it's useful. If you're pressing nothing, no sensation, no pain. Then you're pressing onto nothing. Okay. So for example, if in the morning you wake up very stiff, your neck very stiff, cannot turn, right? So you find this acupoint and rotate your neck at the same time. Okay. Okay, rotate your neck at the same time to help to release the tension of the neck. Okay. Yes, 曲池穴 is on both arms. Okay, so not only one side. So same for 风池, it's both sides, both ends of the neck. Not only one side. Okay, I'm not showing one side. The other side is just like that. Okay, most importantly, you need to have the aching sensation, and then it's useful. All right, so that's 曲池穴. So 风池, 曲池. The next one introduced is 后溪, 后溪穴. So this on the small intestine meridian. So where is it? So you can see from the picture, it's on the end of your hand. Okay, let me adjust myself. Okay, so clench your fist. Then you can see some of the flesh will be sticking out. Okay, like they'll form a very pointy end. So you can find the end here. You press it. Okay, you press it. So sometimes I would suggest sometimes your fingers maybe sometimes too big or what, won't find that aching sensation. And what you can do is you take a pen. Okay, you have a pen, you just press onto here. Okay. Okay, that's a round or a rounded shape, a stick or something. You can just or chopstick, just press it here. Okay. Usually, so same thing. You might need to feel an aching sensation. Then it's useful. Okay, so when to press 后溪穴? So just now I mentioned, you wake up, you feel very stiff on the neck. So other than 曲池, the next one you can press is 后溪. Okay, so press these two sides. These two sides to relieve the neck tension. Okay, so gently clench your fist, locate 后溪 acupoint. Use your thumb or hand just to apply pressure and gently massage until the area feels sore or numb. Okay, at the same time also rotate your neck. Okay, so some patient might ask, hey, my neck pain, I have my neck pain is on the left side. So which hand should I press, left or right? So actually, number one, press on the same side first. So if a pain on the left side, so that's the left side neck pain, you press on the left side first. Okay, see if it's relief or not. So if release a bit, doesn't really relieve much, you try on the other side of the hand. Okay, so you go to the right side. All right. So that's how acupressure. Or if not, if you have time, just press both sides. Help to relieve the both sides of the neck. Okay. So next we touch on a bit of neck stretches and exercises. This is also same goal. Help to release tension in the neck and help to relieve tension and pain in the neck muscles. And also this is a bit important, help to activate those less commonly used muscles in the neck. Okay, and also strengthen up the neck muscles so that the pain won't keep recurring or the injury won't keep recurring. All right. So first one, this is trapeze stretch. Okay, so first trapeze just now, if you all remember, is over here, from the neck to the shoulders and down to the upper back. Okay, so how to stretch the trapeze muscle? So sometimes you might feel pain or stiffness over here, or the neck here. Okay, you can do this stretch. So how to do it? Okay, just place one hand behind your back. Okay, this one the back just put behind. Then, so one thing to note is if you want to stretch this side, so if you want to stretch on the left side, you must look on the right. Okay, so again, so you want to stretch this left side. Okay, the video a bit mirror image, but okay, just listen carefully. So if you want to stretch the right, stretch the left, you look to the right. Okay, maybe around 45 degrees. You put your hand on the head and push it down. So your head, you look 45 degrees, I need to maintain at that position. Okay, maintain the position and push it down. You will feel a stretch here. Okay, sometimes it might go all the way down to the shoulders here. Okay, that's stretching your trapeze muscle. Okay, so hold it there. Once you push it down, you feel a tension over there. You just hold it there, count to 20 seconds, or it can even go up to 30 seconds. Okay, then release. Okay, then same goes for the other side. If you want to stretch your right side, just look left, 45 degrees, then put your hand on the head and push it down. Okay, most importantly, you need to feel a tension here or stretch over here. Once you feel that, you just hold it there for 20 to 30 seconds. Okay, and after that, you release. Then rest for a while, then continue another set. Okay, so this stretch is useful for those who have been neck pain radiating down to this area, which is very common. Everybody neck pain, this part will also be tight, your trapeze muscle. Okay, so this is trapeze stretch. Next one, shoulder rotation. So this one is useful for those on computer for long hours. So computer for long hours, what happens is that your neck will keep going forward, right? Going forward, then whole upper back area will be tense. So you can do this exercise, shoulder rotation, to help to release some tension over at the back. Okay, so how to do this? Shoulder rotation, some of you might know, like just rotating the shoulders, right? Very easy. But one thing I want to add on is, you can see behind your shoulder, there's two shoulder blades called the scapula. What you need to do is to squeeze that two scapula as tight as possible. So usually I'll tell patients, imagine the back, there's a $2 note there, just squeeze the $2 note. Okay, you must squeeze as hard possible, then you will have that relief over at the upper back. Okay, so this one can do it sitting down or standing up. You just lift up your shoulders, roll it backwards, squeeze the two scapula together, or your shoulder blades as close as possible. You'll feel a tension there. Then after that, you release, then repeat. Go up, back, down, go up, then squeeze, go back down. Okay, usually you do 10, 15 times, you will feel a bit of aching sensation already over at the scapula or over your neck. That's where you can stop. Okay, so usually I'll suggest this to do if you're working from computer, probably you can do every hour or every 1.5 hours. Okay, for those who are having neck pain, for those not, maybe 1 to 2 hours each time. Okay, just to do this rotation. Okay, that helps to reactivate your neck and also bring back your neck. What do you mean by bring back my neck? Sometimes you do this already, you know that, hey, you'll be conscious that, hey, my neck is too forward. Then you can bring back your neck. So only do rotate backwards. Okay, don't rotate forward. Because you're already slouching forward, if you keep rotating forward, then your whole body will go forward and your neck will remain forward at the same place. Because your neck's already forward and your shoulders blade off going forward. If you keep doing forward again, rotating forward again, you're not bringing your body back, you're not bringing your shoulder blade back, you're not bringing your neck back. Okay, so always roll backwards. And most importantly, squeeze the shoulder blade together. All right. So there is 2 main exercises that I'll be touching. So trapeze stretch, one is a trapeze stretch, the other one is shoulder rotation. Okay. So lastly, just a short summary, how to manage your your neck issue. Okay, so this is more like a recap of what I've said just now around. Okay, so number 1, regular exercise. So what exercise to do can help? Which exercise is the best to help with your neck and even your back issue, right? Is swimming. Okay, so swimming is one of the I would say the best exercise that you can do if you are having those neck or back issues. Why? Is because swimming and neck so when you are swimming, you'll move your neck and the back at the same time. Right, you'll rotate. If you are doing freestyle, you rotate the neck side to side. If you are doing breaststroke, you go up and down. This will help to loosen up the muscle and also strengthen up the muscle at the same time. Okay, so those who don't know how to swim, the next one you can consider is yoga or Pilates. Okay, those also can help you in managing all this neck and neck pain issues, and also the stretches that I teach just now. Okay, so neck acupressure. So then you have pain, you can try out all the acupuncture points, the three acupoints that I demo just now. So mainly 风池、曲池 and 后溪. Okay. Okay, short recap. Where's 后溪? 后溪 is over here, back of the neck. Okay, there's a depression at both end of the head. Okay, 曲池 here. Okay, at the elbow, 90 degrees elbow here. Okay, then last one, 后溪is over at your palm, end of the palm. Okay, so these 3 points that can help. Then good posture, yeah. So then I spend a couple of minutes to go through the posture. So just maintain the good posture. So good posture, number 1, don't look down. And when you're sitting down on the chair, your buttocks need to stick all the way to the back of the chair. Okay, and your whole back lean onto the chair. So next one, avoid wind, cold, and dampness. So how to avoid? Of course, okay. So number 1, when you're sleeping in aircon room, so try not to sleep. Don't switch the aircon too cold lah. So what I suggest is 25 degrees and above. Okay, 25 degrees and above when you are sleeping in an aircon room. If you are using fan, try not to blow directly. So those with ceiling fan, jialat, how to move the fan, cannot, right? But those with rotating fan can oscillate on, this one is okay. So try not to blow directly at you, the fan oscillate. So if you have ceiling fan, keep blowing at you the whole night, right? What you can do is can wear, if you're having neck pain, right? Try to wear clothes with sleeve. Okay, sleeve or a bit of a collar. So don't wear singlet to sleep. Okay, so don't wear the singlet. Singlet will expose all the neck muscle or the shoulder muscle. Then in the morning you will have all this pain. Okay, so when it's rainy season like nowadays, so yeah, it's very wet, it's very cold, right? If you go out, if those already having neck pain, all this, try to cover up, lah. So don't wear, for ladies, don't wear too much of the tank top. Okay, that will expose all the muscles at the back. Then for guys, try not to wear so much singlet. Okay, just wear cover up, cover up your body. Same goes for those leg pain, or the pain, just cover up. Okay, long pants, wear socks to sleep. Okay, so avoid high risk activities that will cause you to get injured. This one, so sometimes to get injured, sometimes it's not what you want. So what you can do is to avoid. So when you're driving the car, just to take note of the traffic, not go so fast. Then if you are doing any high risk sports or even high risk activities, like one activity that one patient, some very interesting, bumper car. Okay, so I got one patient went to, I can't remember where, maybe it's a cruise, and then there's a bumper car. Okay, this time the bumper car bumped him too hard, and it caused a bit of whiplash injury. Then have this neck pain, his neck pain start to occur. Okay, so these are some example of high risk activity. So if you having neck pain already, try to avoid all this. Okay, so if the pain doesn't goes away with all these maintenance tips that I teach you, tell you, then you can seek TCM help or even can seek medical treatment. Okay. So one last point, yes. Okay, so those who do not know yet, since 2021, there's MOH started to give subsidy treatment for acupuncture. So acupuncture is for neck pain and back pain. Okay, so this only applies in outpatient clinic, which is in the hospital. So what if you are coming for acupuncture in the clinic, then you require a referral letter, then from the doctor, then you will be eligible for the subsidy. Okay, so this is just FY info for you, for everybody. And okay, so that's the end of my sharing session. I hope everyone have something to take back. Okay, so let me take back. Just watch out for your posture, and also can do all the acupressure exercises that I taught you just now to relieve the neck pain. Okay, thank you everybody. I think now we have a bit of a time. How 1 minute, 2 minutes to take some questions. Okay, so now we could move on to the Q&A. Just let me open up the Q&A section. Okay, wow, there's a few questions. Okay, so first one, okay, let me answer live. Can see? Can. Okay, can we do anything like exercise to restore the natural curve of the neck if it's been straightened due to a past accident? The answer, unfortunately, is no. So when there's damage to the spine, to the bone, to the curvature, or not say damage to the curvature, damage to the bone, damage to the joints, right, which result in losing the natural curve of the neck, yeah, it cannot be go back. So it cannot go back, reverse back to the original state. Okay, so the thing already, the bone already degenerate. So you cannot go regenerate back to the original state. So sometimes people might ask, one of the common questions, does going to chiropractor or doing those manipulation help to go back to the natural curve of the neck? Unfortunately, the answer is no. So all this manipulation just helps to release the small little joints at the side of the bone, the spine, the vertebral bone. Okay, it doesn't crack all the way to make the, it doesn't adjust it back to the normal curvature of the spine. Okay, so that's why you hear the pop, 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 is because of the bubbles in the small little joints at the side of the spine. Okay. Take how many more questions? One more. 2 more. Okay. I'll stick any more. 2 more questions. Okay, are there any side effects from acupuncture? Okay, so side effects from acupuncture, can range from mild or serious lah, but usually serious very rare. So mild, I can share with you some mild side effects. So number one, most common one is bruises. So similar as injection. Sometimes you go for injection, you have mild bruises of where the needles will poke. Okay, this is because when the needle go in, you will have a bit of it will prick all the minor capillaries over at the surface of the skin, causing bruises. So these bruises is similar when you have a knock or hit onto something, you have a bruise or blue black over at your skin. It's the same. Okay, so these are one of the most common mild side effects from acupuncture is actually bruises. So other major one which rarely happen. So major bruises is one. The other one is sometimes the needle might break inside the body. So that's very rare. So far in Singapore, I don't think there's any cases yet. Okay, so that's the side effects for acupuncture. Okay, I'll take one last question.
You can take
A few more. Okay. Okay, got one person asked, do we have massage services? Okay, the answer is no. We don't have to now. Maybe you can write in to us. Usually we just do acupuncture. Let me see. Okay, there's one from AL Tan. Is it safe for elderly folks on aspirin and other blood thinners to undergo acupuncture treatment? Okay, so for aspirin or blood thinners, it's safe. So we accept patients with blood thinners, with aspirin or other blood thinners like clopidogrel, all this, we accept them to do acupuncture. So for those we do not accept is those on anticoagulant. Okay, so warfarin, things like warfarin, all this, we will not accept because we are afraid there'll be massive bleeding when we take out the needles. So usually we don't do patients with anticoagulant. So people with heart issues like fibrillation, or sometimes those with patient just who got stroke, they might be on anticoagulant. That's when we won't really do acupuncture for this group of patients. Okay, so for aspirin, yes, because a lot of patients, I think almost half the patients that we have usually are on aspirin. So it's safe. So sometimes what we need to do is just to look out for bleeding. So when there's bleeding, a bit of blood coming out from the puncture point, we'll just press to stop the bleed. Once the bleeding stops, then it's okay already. Okay. Okay, one more question. Let me find a question related to neck pain. Okay, go. There's one. Can I put a cushion to support my back? Okay, so this one. So this one probably from Melody. So this one, I assume that you're talking about sitting down lah. So can I put a cushion to support my back when sitting down? The answer is yes. So basically, your buttocks or the lower back need to touch fully onto the backrest of the chair. Okay, so depending on where you put a cushion, usually I recommend putting on the lower back, not on the upper back. Why? Because lower back, if you remember the pictures, let me find a picture of the lower back. Give me yes, this this one. So you can see from the normal curvature, right? See your lower back is actually curved inwards to your body. Right. So that's where you can put your cushion. So to maintain the normal curvature of the lower back. Fine. Okay. So yeah, you can put a cushion. But of course your cushion cannot be too hard. Okay, don't be so rigid. Put a softer cushion, or sometimes you can put a memory foam lah. Because if too hard, you might put too much pressure on the back. Then in turn will cause more pain instead. Okay. Can? Okay. Let me check that. Okay, so I'll end my Q&A. So if any question, probably can call our clinic or to ask a question regarding acupuncture, or whether you are suitable for acupuncture lah, or any the thing about subsidy. All right. So okay, thank you everybody. I think we have a feedback from hand it over to our panelists.
Okay, thank you, Derek. And I believe everyone has learned a lot. It's a very informative session. I think me myself also been learning and listening to all the tips and exercises. So before you go today, we hope that you can share with us your feedback by filling up this feedback form, so that it will help us to understand a little about your interests and other topics that you want to hear. And also by completing this feedback form, you can leave your email in the field, so that we can also share with you today's content, today's slides. Okay, and with that, we will end the session today. Thank you for joining us.